Hi, this is Dr. Bernstein with our December 2019 teleseminar. Before we start, I want to give you the usual caveats, namely that my answers to questions are generalized answers intended to educate the listening population, the listening group. Since I have not done a physical exam or gotten a complete history of the questioner, my response might be totally inappropriate for that questioner, but it will be educational for the group. So before proceeding with any ideas that I come up with, you should discuss the answer with your physician. The other caveat is that I'm trying not to answer lengthy questions or questions that are really multiple questions. So if someone asks 4 questions, all numbered as if they were part of one question, I'll cross out 3 of them and answer 1. Now today we have 2 special subjects. First of all, there was a meta-analysis of many studies comparing individuals who consumed more than 3 servings a week of red meat versus people who avoided red meat. And the results of this meta-analysis were published in Archives of Internal Medicine in October of 2019. And they came up with new guidelines that do not restrict the consumption of red meat in order to benefit your health. In fact, they also point out that some people, for health reasons, perhaps should be consuming red meat. So the warnings against red meat that are so popular in the press and on the internet apparently are invalidated by this meta-analysis. Now, I'm not telling people go run out and eat red meat. I'm just pointing out the results of the meta-analysis. I personally think that the breeding of animals to then kill them is not a civilized thing to do, but it seems to be necessary the way we're currently organized. You may have encountered cover stories on many diabetes journals, including this one from the American Diabetes Association that says, 0 fingersticks, glucose readings on my phone, total game changer. And that's an absolute lie. Apparently, the sequence of events goes something like this. There's a freestyle CGM, continuous glucose monitor, that started advertising in competition with Dexcom and making claims that initially Dexcom hadn't been making, namely that there were no more fingersticks if you used their instrument, the freestyle instrument. This was a lie because you do require fingersticks to calibrate it and also to correct it, because both instruments, any continuous glucose monitor that's matches current technology, has to be at least half an hour, 20 minutes to a half an hour behind the actual reading, and in many cases may be way off from the actual reading. In my experience, I have a Dexcom continuous glucose monitor. I have to do more fingersticks since I got the glucose monitor than I did before the glucose monitor. Why? Because it's not always accurate. And my main reason for having it is to get warnings of hypoglycemia. And I would say that about half those warnings are erroneous. So I have to, if I get a warning, I get a siren alarm that can wake anybody up, and the first thing I'll do will be to check my blood sugar. And half the time, it'll be a valid warning and I have to take some glucose. But the other half of the time, I have a normal blood glucose or maybe even slightly elevated. So I do more finger sticks since I got my CGM than I did before I got the CGM. So don't believe what you see on the cover of the diabetes publications. Our first question. How does the Livongo one-drop blood glucose meter compare to the accuracy of the Freestyle Freedom Lite? I use the one-drop app and find it very useful. Well, you can check the internet for comments by users as well as I can. What you want to look for is accuracy, where they've actually compared the Livongo with the Freestyle. I use the Freedom and the Freedom Lite. I usually carry one Freedom Lite with me when I'm away from home, and two Freedom Lights and one Freedom. Why? The Freedom is easier to read and has a louder noise, so I prefer it. But I don't want to carry too much bulk around with me, so as a backup, in case it goes bad, I have two Freedom Lights, which are much smaller. How to cure type 1 diabetes naturally? Well, one thing that you might try if you can is to change your parents retroactively. And if you can change your parents, it might work, but it's not guaranteed. I can't think of any other more natural way to reverse diabetes. I'm 36-year-old, late onset type 1. I am not on insulin because my endos, in the light of my 5.6 A1C that I got with a minimal carbo, high protein diet, will not write a script and refuse to acknowledge your methodology for lack of clinical trials. So this person's endocrinologist will not give her allow her to have insulin for type 1 diabetes. At the same time, strict dietary adherence has continually reduced my blood sugar, so now I consistently get blood sugar readings between 80 and 110 in the morning and after meals. These are my best, most consistent readings since I ever started testing. Is this acceptable for the time being, or would you suggest that I still consider a basal insulin dosage? Well, the decision really should be up to you. One thing you can think of is taking the smallest possible dose of Tresiba insulin. You can now get it in vials and inject it with an insulin syringe that measures half units. So you might want to try a half unit of Tresiba once a day, or you could try the extended release metformin if you can get it. Well, you should be able to get it. It might have trouble getting Glucophage, the brand name, but extended release metformin is available in the USA and around the world. Another thing that you could consider is looking into the Verapamil study performed at the University of Alabama in Birmingham, where they it's a small study where they seem to have gotten some degree of beta cell regeneration with the aid of Verapamil, an antihypertensive drug. I'm a 62-year-old type 1 diabetic for 36 years. That person is a survivor. Hypothyroid, taking Armour Thyroid, which has begun causing intense nerve pain in my hips and thighs, as well as difficulty sleeping overnight. Unithroid, which is a synthetic version of T4, a levothyroxine, has also caused these same side effects. When I stop taking either one, side effects completely stop. My blood sugars have been all over the graph with these side effects. What to do? Well, if the pills have a coloring agent, as do most strengths of Synthroid, then you could try switching to the colorless version if your doctor thinks that you're having an allergic reaction to the coloring material. Another thing you could do is check your free T3 and free T4 using the accurate tests that we recommend on our videos. There are several laboratory tests that the big labs have, the expensive one and the cheap one. You want the expensive one for free T3 and free T4. And you also might check your reverse T3 level. With this information, your doctor may be able to piece together whether your thyroid levels are too high or too low. And by separately adjusting the doses of T3 and T4, rather than giving you a mixture, which is what Armour Thyroid is, you might be able to get better results. But I can't guarantee any of this because I usually do not see pain as a result of taking thyroid replacement. I have one patient right now who gets severe pain from muscle breakdown as a result of going for years without thyroid replacement. I'm a breastfeeding mom, 30 years old. I am from Mongolia. I have been diagnosed with diabetes, had a ketoacidosis last month. Please give me advice on taking insulin or other medicine for the treatment of diabetes. All I can say is read my book, Diabetes Solution. Our teleseminars are for people who have read the book. I'm a type 1. I don't understand well if I am to apply insulin, even if I am fasting or skipping meals. I usually only apply long insulin Lantus. Is that right? Again, read my book, Diabetes Solution. I'm a type 1 diabetic, and a week ago, I started a very low-carb diet, 10 to 30 grams per day. Prior to this, I was eating and injecting large amounts. I have lost approximately 4 kilograms, that's about 10 pounds, during the week. My blood sugars have improved remarkably. The big swings I had previously seen between 81 and 162 milligrams per deciliter are now gone. No blood sugars at all above 234. no blood sugars below 3.9 millimoles. That would be about 75. No blood sugars below 75. My nurse today tested my urine for ketones, and the result was 4+, very high. I have read about the keto diet, and I'm curious whether it is normal to have high ketones on this diet, or whether there is a way to maintain the good blood glucose control without the side effects of high ketones. First of all, I'd recommend that you read my book, Diabetes Solution. Secondly, ketones in the urine reflect the breakdown of fat, usually body fat if you're losing weight. So, if you're overweight and want to be losing weight, the ketones in the urine are a sign that you're losing weight. Dr. Atkins used to advocate that people who want to lose weight check their urine for ketones periodically, and I don't advocate that because all you have to do is look at the scale to see if you're losing weight. I have 4 boys. 2 are type 1. My third is in a trial net and received 12 months of IV therapy to help prevent type 1. And I wonder just how realistic this is, or if that's fraudulent. Technically failed his last glucose tolerance test. We are going back to Dallas, 12 hours round trip, for another test. He has horrible stomach aches and is missing school. We know diagnosis is days away. What do I start first with your program? Is it too late? Well, it's never too late to start normalizing blood sugars. The longer you wait, the more likely you're going to burn out more beta cells, the more likely you're going to get complications, and especially the more likely you're going to get gastroparesis, which can make blood sugar control very difficult. So read my book if you want to know what you should be doing right now. Also, you might want to look into the study of Verapamil at the University of Alabama in Birmingham. It will not prevent the diabetes, but may slow down beta cell loss. Type 2 diabetes for about 25 years, treated for 15 years. What can I do to reduce my blood sugar readings between breakfast and lunch? I have only a boiled egg and less than 1 ounce of cheddar cheese and 1 to 2 cups of coffee with stevia and half and half for breakfast. But high midday blood sugar. Oh boy. I take Humalog on a sliding scale before breakfast. I also take 2 milligrams of Amaryl in the morning. Until the last 6 months, my lunchtime blood sugars were normal, but now higher than before breakfast. I walk 2 miles in the afternoon and blood sugars are usually normal at dinner time. Okay, well, first of all, Amaryl is like a sulfonylurea. It pushes beta cells to make more insulin and therefore can accelerate beta cell burnout. So I'd suggest you get off the Amaryl. And I think that you read my book and that you adopt a constant meal plan while you're experimenting with what doses of insulin you need to cover your meals. You probably would need insulin before meals, or at least before breakfast, but the timing of the insulin and the amount of insulin and the kind of insulin are all covered in the book. There is a doctor online offering pills that use stem cells to fix diabetes. Any good? Question mark. Well, if they worked, there'd be no more diabetes. I actually saw such pills advertised on Amazon, and so there are probably a lot of people taking them, and I don't hear any people boasting about how they cured their diabetes. And you could bet that all the diabetics would be using them if they really worked. And I don't know what on earth a stem cell pill could be. I've read your book, Diabetes Solution, about the dawn phenomenon. My waking blood sugar's in the high 90s, the low 100s, if the time is 9 a.m. or earlier, but immediately starts going up to over 140 after 9 a.m. and when I start moving around. The rise, in turn, directs me to increase my insulin by 1 or more units. I don't understand why. Well, the dawn phenomenon is gone into in great detail in my book, Diabetes Solution. You supposedly read the book, but I don't think you read it very carefully. I think we have a whole section on the dawn phenomenon, and what we recommend for type 1s is that you start with basal insulin twice a day, and there are ways of deciding when to take it that we explain. We explain, we don't have Tresiba in the book, but Tresiba is now the longest acting insulin we can use. We give it twice a day. And some people, even when they take Tresiba twice a day, have to take a unit of, or a half unit, or a few units of rapid acting insulin on a rising to prevent the dawn phenomenon once they get walking around. I actually have several patients who will inject a little bit of diluted Humalog, very rapid insulin, intramuscularly to make it work fast when they get up in the morning. I just read in your book that we diabetics should not take more than 500 milligrams of vitamin C daily, as it could cause neuropathy. Well, I was already diagnosed with neuropathy in my feet, and now I believe I feel it in my hands. I take lots of vitamin C because I had a stroke and then cancer in 2017. So I also take a multitude of other supplements given to me by my chiropractor. He looks at my blood tests and also uses a computer program to determine the supplements I need. So what do I do about the vitamin C? Well, high doses of vitamin C can also increase blood sugar. They can destroy the enzyme in blood sugar test strips. And I would suggest that you get a real doctor to treat your diabetes. I've known of a number of chiropractors who give their patients a bag of pills, sell their patients a bag of pills to take home every month, and say that that's going to cure their diabetes. I have type 2 diabetes. Can I do intermittent or longer fasting? Well, one big question is why? Why on earth would you want to do that? Unless you don't like food, or maybe if you're overweight. But if you're overweight, I would suggest that you cut way back on the carbohydrate and see what happens. If you're not on any blood sugar lowering medications, it's probably safe to do fasting. But if you are taking blood sugar lowering medications, and your blood sugars are now normal as the result of these medications, if you start fasting, they might go too low. I'm a type 2 diabetic and my blood sugars went up to 12 millimoles. That's an average blood sugar of about 210 milligrams per deciliter, while I wasn't checking it over a period of a few months. My eyesight changed and I had to use my reading glasses for seeing distance. That's pretty amazing, to use reading glasses for seeing distance. I started taking metformin, and my blood sugars have normalized to around 5 millimoles, which is about 90 milligrams per deciliter. Will my eyesight go back to the way it was? I don't know, but it's a possibility. Many, many years ago, I worked for a company located on Fifth Avenue, New York City, and we were half a block away from the street sign. And these were the days before I got a blood sugar meter. And I remember walking out of the office by mistake without my glasses, which are for seeing distance, and I could read the street sign perfectly clearly without my glasses. So my vision got better for distance, and somehow I knew it was because of my very high blood sugars, because my urine tests were always quite high. Why is Dexcom's approximation of the A1C with their GMI much higher than it should be? Any light you can shed on this would be greatly appreciated. Well, first of all, Dexcom is measuring interstitial fluid blood sugar, not true blood sugar. But the interstitial fluid blood sugar should lag behind true blood sugar. So on average, you should come out with an average blood sugar that probably is correct. They also use an undisclosed formula for calculating their A1Cs and their average blood sugar levels. So without knowing how they make the calculation, it's impossible to determine whether there's any accuracy to it. I would go by your blood sugars. They display a chart of what your blood sugars are overnight. You could use your measured blood sugars from a meter during the day and see what the blood sugars are from the Dexcom overnight and get a pretty good idea of what your average blood sugar is. You could also get a hemoglobin A1C, but that will not tell you about the variability of your blood sugar. I've been on your diet and intermittent fasting for over a year, yet my A1C is still 5.9. Why is this? What else can I do? Well, if your A1C is 5.9, you may be diabetic. And diabetics frequently have to do more than just follow a low carbohydrate diet. And certainly intermittent fasting is not going to cure the diabetes. So if you're diabetic, you may need medication. I suggest you read my book, Diabetes Solution. I'd like to know if a non-diabetic person like me should control her blood sugar by using an insulin meter device. I assume she means a blood sugar meter. Well, first of all, you might want to know what your hemoglobin A1C is, what your average blood sugar is. If you're curious about your blood sugars and you're not diabetic, you could check them. But I don't know of any true non-diabetics who use a continuous glucose monitor or who even check their blood sugars with a blood sugar meter, unless there happens to be another diabetic in the household. If your blood sugars are routinely fasting blood sugars, let's say over 100, after meals, low carbohydrate meals, let's say over 120, you might want to check blood sugars and learn a little bit more about yourself. Then you might want to read my book, Diabetes Solution. I'm a type 1 insulin-resistant overweight female. I also have polycystic ovarian syndrome. I try to follow a low-carb lifestyle. I don't exercise daily, but that is needed. What can I do to lose weight? Often I'm tired. Well, if she's often tired, could possibly be hypothyroid. Certainly should read my book about controlling blood sugars, and if you know you have polycystic ovarian syndrome, there are treatments for this, one of which is D-Chiro, C-H-I-R-O, inositol, also by brand name called D-Pinitol, P-I-N-I-T-O-L. D-Pinitol is being used to treat polycystic ovarian syndrome. With what degree of success, I'm not sure. You might want to try to find a physician who specializes in PCOS. Very hard to find. There is no surgical solution to my knowledge, so that if you even remove the cystic ovaries, you don't get a change. The big problem is usually insulin resistance, and the high insulin requirement may cause an elevation in testosterone. It's pretty complicated, but your doctor might want to prescribe D-Chiro-inositol. I'm at the maximum dose for extended release metformin. How can I tell when it is no longer working effectively? You check your blood sugars. When I recommend metformin in a mild type 2 diabetic, I usually see blood sugar improvement. Don't always see blood sugar normalize. Might see it normalize in a very, very mild borderline diabetic, but certainly you could check your blood sugars. Is there a test for beta cell function? In the book, we mentioned 3 tests. One is checking blood sugars. Another is measuring the hemoglobin A1C, and the third is measuring the C-peptide level. And all of these are discussed in my book, Diabetes Solution. Can a type 2 diabetic have non-alcoholic fatty liver disease with a normal liver function panel? Absolutely. In fact, most of the new patients that come to see me, by new I mean they're new to me, both type 2 diabetics and type 1s, the bulk of them have non-alcoholic fatty liver. That is, I feel their liver and I locate it and it's enlarged and clearly enlarged, but their liver function tests are normal. And by the way, the term liver function test is not a good name. It should be a liver destruction test, because the values go up when there's breakdown of tissue in the liver. In the new era of direct-to-consumer genetic testing, what information is valuable to investigate when trying to achieve the best nutritional intervention for optimizing individual normalized blood sugars. We already have the intervention. It's my book, Diabetes Solution. Anyone who wants to do genetic testing and then tell you what to eat is ripping you off. What treatments would you recommend for cataracts with surgery only as a last resort? Well, my recommendation, first of all, with regard to cataracts, is that you only undergo surgery if your vision is being significantly impaired so that it affects your lifestyle. Elevated blood sugars can cause cataracts, but by the time they're very advanced, normalizing blood sugars is not going to reverse them. There has been one study in dogs with cataracts at the University of California in San Diego, where they gave the dogs lanosterol, Lanosterol, lanosterol eye drops, and they reversed cataracts in dogs. But unless you're a dog, we don't have evidence that this will help you yet. In your book, Diabetes Solution, you recommended not using Lantus because studies, that's Lantus long-acting insulin, studies have shown that it has an association with cancer. Since other studies have shown that the diabetic population at large has a higher occurrence of cancer, do you still believe Lantus should not be used? That's my personal feeling. The American Diabetes Association doesn't share this feeling, but we've disagreed on a number of things. I'm not absolutely certain. There were studies done of countries with National Health Service that keeps track of the ailments that the patients have and what drugs they're taking. And I believe 3 out of 5 countries in Europe found that Lantus was associated with more cancer, and 2 out of 5 did not find such association. So it's not an absolute certainty. But the logic is there because Lantus insulin has 165 times the affinity for IGF-1 receptors on cancer cells, and the cancer cells proliferate when IGF-1 receptors are stimulated. When I said 165 times the affinity, 165 times the affinity that ordinary human insulin has for these receptors. What are the most effective strategies to lose weight for a type 1 diabetic? 1, you read my book, Diabetes Solution. 2, you reduce the carbohydrate, and at the same time, while you're reducing the carbohydrate, you reduce the insulin so that your blood sugar doesn't go too low. And since insulin facilitates weight gain, your weight should come down. My daughter is 7 years old, type 1 diabetic. Her fasting sugars are above 90. When she eats food, sometimes her blood sugar goes beyond 150 after 30 minutes. Please suggest how to prevent the onset of type 1 diabetes. Well, he says my daughter is 7 years old and a type 1 diabetic. So if she's diabetic, she's diabetic. Her A1C is 5.5 currently. Now, diabetic kids, I should say normal kids, non-diabetic kids, tend to run in the 60s and 70s. 7-year-old, probably around 65 or so. So if her blood sugar goes up to 150, no, beyond 150, she's clearly a type 1 diabetic. I don't know why you're wondering about this. My 8-year-old daughter, recently diagnosed with type 1 diabetes. Her sugar before lunch and dinner is generally high, above 200, and I definitely want to help her get her sugars in the normal ranges. Please suggest what to do, as I feel very confused on how much carbs are actually required for kids. Kids require very little in the way of carbohydrate. They do require vitamins that some carbohydrate vegetables contain, but I would say for an 8-year-old, maybe 3 grams at breakfast, 6 at lunch, and 6 at dinner might be appropriate. I should say for a 70-pound kid. I don't know what your child's weight is, but for 70 pounds, 3, 6, and 6. But I also suggest you read my book, Diabetes Solution. And remember that most endocrinologists are going to advocate very high carbohydrate intake and also very high blood sugars for kids. And of course, the repercussions over the long term are horrendous. My C-peptide value came back 0.6. My A1C is 5.8, which is an average blood sugar of about 130, and morning glucose about 100. What should be my most important sugar control steps? The first would be to read my book, Diabetes Solution. The next would be to lower your dietary intake of carbohydrate to the guidelines that we give. And then if your doctor allows you to exercise, I advocate exercise. Again, if it's safe, I advocate both bodybuilding and rapid heart rate exercises. And it's all in my book. There's also the possibility of using metformin, possibly extended release metformin, or the rapid release if you go up after meals. And it's all covered in the book. My daughter is 11 years old. There is a study at Mass General Hospital regarding the TB vaccine to help preserve remaining insulin production. Do you think it would be a good idea to get a child with pre-type 1 diabetes the TB vaccine? Well, the problem is that other labs have not been able to duplicate the results. However, it shouldn't be harmful. So aside from time and possibly money, you're not putting her in any jeopardy that I know of. So it's not likely to be harmful. Question is, will it be of any value? My daughter is 9 years old, recently diagnosed. Her sugar levels have been on a constant roller coaster, and I feel miserable seeing her blood sugar when she's high or low. I tried giving her an extra shot before she snacks, but she does not want to take it and instead prefers being hungry. I am scared that the high sugars are going to affect her body. Need advice on what to do. Well, join the club. This is a very common problem. You might want to join the Type 1 ONE GRIT group on the internet, on Facebook, and see what other parents are doing with kids who like to snack. What I try to do is find out what time of the day are they hungry? How long is it after the last meal? Am I giving them enough food at the last meal? Frequently, by upping the protein at the meal before which they get hungry, they don't get hungry at that time of the day. Or we might change the timing. Some kids have to wait 6-8 hours between lunch and dinner. By moving the dinner earlier in the day, they're less likely to get hungry in the late afternoon. So you could juggle things around to prevent the need for snacking. As a last resort, you make the snack a high protein snack and cover it with a small shot of fast-acting insulin. Again, reading the book would be helpful. Eight-year-old daughter, type 1. Blood sugar drops dramatically if she goes to bed at anything less than 200 without taking a cup of milk before sleeping. If I keep her above 200 as advised by her doctor, she does not get a hypo and her sugar is in the normal range by morning. My daughter does not feel hypos at night. We don't know until we check her midnight. She has a CGM, but it's giving her a rash. Well, first of all, read my book, because I suspect you're not using long-acting insulin properly. To deal with the rash, there are two things you might do. Number one, you rub a little bit of 0.5% hydrocortisone cream, not ointment, but cream, into the skin before you put on the patch or the adhesive that may hold the Dexcom patch in place. So you rub this into the skin, then rub it off so that the skin is not greasy so that the patch can't stick. Also, Dexcom makes an overlay patch which they don't tell you about, but if you call tech support and ask them to send you a package of overlay patches, they'll send them to you for free. And these are they have a hypoallergenic adhesive. They shouldn't cause an allergic reaction. So read my book and do these various things. 18-year-old daughter is a freshman in college, has had type 1 diabetes for 10 years, has followed the regimen given to us since she was 8 years old. She's been unable to pass her fitness test to participate in Division I soccer. My husband and I are thinking glycation of her muscles could be contributing to this, and she asks me to confirm that. And she's been on a low-carb diet for probably close to a year now, but it hasn't been as low as you prescribe. Well, this sounds familiar because when I was in college, I wanted to join the fencing team, and I had to try out for it. And you had to jump 1 foot high in the air, and I couldn't jump 1 foot. Now, the rest of the guys on the fencing team were big guys with long arms, and most of them had no trouble jumping 1 foot. Now, I doubt that it was because I had glycation of muscles. I was, up until shortly before that time, playing tennis very actively, and that was not a problem. So it could be that there's just a test that you can't do. But certainly, if she is running high blood sugars, she's going to be weak and also possibly depressed. So you might take a look at Dave Dykman's videos that he posts on Type 1 Grit. And here's a kid who has kept his blood sugars essentially normal since the time of his diagnosis. And now he's 15 years old and captain of at least one high school team. He plays basketball and football. So take a look at his video. You see it's possible for type 1 kids to be very athletic, but you have to get their blood sugars normalized, and it is not glycation of muscle. You also could check for hypothyroidism, which I had and didn't know when I got tested for the fencing team. My daughter is 17 years old and she is in stage 2 of type 1 diabetes. Her fasting sugars are above 90. When she eats food, sometimes her blood sugar goes beyond 150 after 30 minutes. Please suggest how to prevent the onset of full type 1 diabetes. First of all, you should read my book, which tells you how to get normal blood sugars. It's important to have normal blood sugars to slow beta cell burnout. Then we have the Verapamil option. Investigate the study at the University of Alabama in Birmingham, where they use the medication Verapamil to supposedly slow beta cell burnout. In addition, teenagers, especially if they're growing or around puberty, may have hormonal swings, that is, blood sugar swings that are caused by other hormones that are active during puberty. And the metformin seems to stabilize blood sugars resulting from these pubescent hormones. So another possibility is to add to the regimen, which will be a multi-injection regimen in all likelihood, some oral metformin, probably the long-acting form. My daughter is type 1 diabetic for the past 10 years. Her A1C is above 10 for the past 2 to 3 years. Kindly advise on how she can improve her blood sugars on a daily basis. Again, read my book, Diabetes Solution. I can't think of anything else. There's nothing magical. It takes a lot of work. Type 2 diabetic male who is following a very low-carb diet. At rest, all the numbers were dropping to almost normal range, so he took himself off the 15 units twice daily Tresiba. His fasting blood sugar getting higher every day. He doesn't take metformin due to GI upset. Any suggestions? Well, what would you suggest? Common sense would tell me to restore the Tresiba. It seems to have been working. There was no reason for him to stop it. Type 2 diabetic female. Please advise on best way to lose weight. Well, I guess the best way is to eat less. And in particular, you eat less carbohydrate. You could read the book Diabetes Solution. You could also look at my book, Diabetes Diet, which maybe has more recipes if you're interested in the recipe route, but it's a very low carbohydrate diet. My wife, type 1, 37 years old, has occasional spikes of blood sugar that go into 120 or 130. Well, that's unusual for a type 1 to only go to 120 or 130. This happens 1 or 2 times a day. She averages near 95. So, are there long-term health effects of these small spikes in level? Well, it's been shown that the long-term complications of diabetes relate to blood sugar times time. So for the longer you have elevated blood sugars, the more of an effect they have on the long-term complications. It's very unusual to see a type 1 with blood sugars that are this close to normal. My guess is that she's still making insulin, but she might want to read my book, and it'll help her to get the blood sugars lower. I love popcorn. After lunch, I test 120. After popcorn, 265. Was hoping somehow I could eat my favorite food. Any ideas, suggestions of what to do about my current doctor who thinks I am normal, not diabetic? Well, you could look at my book, Diabetes Solution, and read about carbohydrate craving. There are some substances that you can take that might relieve the carbohydrate craving. As far as your doctor who thinks you're not diabetic, you probably should find a doctor who thinks that you are diabetic if you have blood sugars of 265. Well, that's it for our teleseminars for the year 2019. Happy holidays to you. You could hear us again on January 29th, Wednesday, 2020. Good luck. And glasses. Huh. Can you see it?